So we are in the midst of the silver tsunami. 11,000 people are turning 65 every single day. This is a historical time in American history. This so many people turning 65. Last year was history making, but this year is continuing that trend. We've got those baby boomers born between 1946 and 1964, and they are turning 65. And let's talk about what you need to do at 65 if you're, looking to retire. Look, talking about Medicare, if you're on disability, and all the rest of it. We want to make sure we save you money and time. A lot of people waste their time by doing things they don't have to do. So we'll talk about that today. This is also a live Q&A. Looks like I already got a bunch of questions. So if you're watching this live, make sure you type your questions down there. If you're not, make sure you subscribe. And then we can come back in the future if you or your family or friends ever have any questions in the future. That's who I am. Let's go ahead and get started on this. One thing you do not need to do is contact Social Security when you're turned 65 years old if you don't need to. We used to get people all the time that contacted us and say, "Yeah, I'm just turning 65. I'm still working. I don't need Medicare and I'm good." It's like, "Okay, well, thanks for checking in, but you really didn't need to call." And particularly now because Social Security is at a 50-year low in terms of staffing, you're going to be sitting on the phone for 3 or 4 or 5 hours and for pretty much nothing. You don't need to call Social Security if you have health insurance from work and all that. Okay, but we'll get into those details. I just wanted to save you time. If if that's all you need, then have a great day. All right. So in terms of 65, that is no longer the full retirement age, FRA. Full retirement age that ended back in the 1980s. Now, if you were born in 1960 or after, your full retirement age is 67 years old. Others out there, it was 66 and 6 months, or 8 months, or 10 months, or whatever the case may be. So 65 doesn't have the relevance it did, from 1935 essentially to the 90s, um, except for Medicare. They raised the retirement age to 66, 67, but they kept Medicare at the same date, the same age. I personally think if you retire at 62 years old or 60, if you're a survivor, I think your Medicare should start at that time, but that's a whole different thing. And once y'all make me the dictator for the day, I'll make that change right after the cure for male pattern baldness. But anyway, so, okay, so you're about to turn 65 and you just might want to sign up for benefits, or you are currently receiving benefits. All right, let's start with you are currently receiving Social Security retirement benefits, survivor benefits, spouse benefits, divorce spouse benefits. You're receiving benefits. Okay. Because you're receiving benefits, about 3 months before you turn 65, Medicare will send you your package in the mail automatically. And they will sign you up for Part A and Part B automatically. And if you want to keep it, you keep it. Be careful though. Um, when you're turning 65, every health insurance company and health agent in the country knows you're turning 65. Yeah, but it's, data brokers out there that track all your button pushes on your computer. But they know when you're turning 65 and they just send you a whole bunch of garbage and they call you continuously trying to sell you a Medicare insurance plan. A lot of people, unfortunately, they get so much junk mail and a lot of it looks official that they just throw it away after a while. And sometimes people throw away their actual official Medicare package and then they don't realize that they have Medicare in Part A and Part B. So be very careful. Make sure you watch out for that. All right. So if you're good, you want to keep your Part A and Part B, you do nothing. You've got your monthly benefits started. You got your Part A and Part B started. You do, in fact, need to find a Medicare plan. And why do you need a Medicare plan? Is because original Medicare Part A and Part B just has too many gaps in there. If you got a few $1,000,000 sitting on your mattress, then you're good. But if you don't, then there's several gaps. Part A has got that deductible. This year, 2025, it's $1,676. So several times a year, you could pay that when you went into the hospital. You'd have to pay the first $1,676. And then if you're staying in the hospital over 61 days, you have to pay more. If you're skilled nursing facility, you have to pay per day. The big one is on the right side there, the Part B. Coinsurance, the one I've got highlighted in yellow there. You pay 20%. So if you have a surgery or $100,000 Band-Aid, you have to pay 20%. So $100,000, you have to cough up 20%. So that's the big one right there. So as you know, the Part B this year is $185. So that's why, unless you got a whole bunch of money and you can self-insure, that's why you definitely need to get a Medicare plan. And you can get, there's plan A and plan B, basically. Well, it's a cat or a dog, truck or car. It really depends on your particular situation. I always recommend, when you're looking for a Medicare plan, you always start with the Medicare Supplement plan, Medigap, same thing, a plan N or a plan G. Fs aren't really available anymore. So a plan N or plan G, you check those out first, and that way you don't have to deal with any, networks or, prior authorizations. But they do come at a cost. The monthly premium, there is a monthly premium, but check those out first. And if it just doesn't work for you because of your budget or something, then check out a Medicare Advantage. And how you do that is check your doctors, whatever Medicare Advantage plan in your area covers most of your doctors, saves you as much money for the prescriptions, saves you as much money for the actual health services, doctors and hospitals and MRIs and CAT scans and all that kind of stuff. And then at the final thing, then look for all the, the fun little goodies, the gym membership and, stuff like that. So, but always focus on the important things. Um, and then if you get a Medicare supplement plan, you will also have to get a Part D plan, the prescription drug plan. And if you get a Medicare Advantage, most of those have a prescription drug plan already built into them. So if you need help, you can reach out to my partners there at Chapter or Point there, and they can help you out. Their help is 100% free. They sponsor this channel and make sure that all this information gets to you. So they're doing an awesome job. All right. So that's if you are receiving Social Security benefits. If you are not receiving Social Security benefits, then if you do want to sign up for Medicare, then you will actually have to contact Social Security. You can call them, schedule an appointment, or go online and file for Medicare online. And you can do several things. You can sign up for Part A only. You can sign up for Part A and B. You can sign up for Part A, and if you're not getting money, you can start your money. You can sign up for Part A and B and start your money. So there's all kinds of different variables depending on your particular situation. Why would people just get Part A only and refuse Part B? Because you can refuse Part B. If you don't want Part B at 65, you can refuse it, but you have to have credible coverage. And what is credible coverage? That you have health insurance from your work or your spouse's work, and that employer has 20 or more employees. So current work, not, COBRA, not a retirement, health insurance plan, not the Affordable Care Act. It has to be through current work, yours or your spouse's, and 20 more employees. If you have that, then you do not have to sign up for Part B. You can, just say refuse it. And then 5 years, 10 years, 20, 30 years later, when you stop working, then you go ahead and you sign up for Part B, and there's no penalties. What are the penalties? The penalties are 10% for every 12-month period you did not have Part B. And there's also a penalty for Part D, the prescription drug plan. That's 1% for every month you did not have Part D when you were supposed to. But if you have credible coverage, you don't get penalized. You just have to, this is a bureaucracy after all. There's a couple of forms you have to fill out. One of them is so the future special enrollment period, SEP, special enrollment period. You fill out this form. It's a 40B and a 564. And the 564 form, you take down your employer, and they say, yes, this person did have health insurance since the age of 65. Don't penalize them, and you won't get penalized whatsoever. No problem whatsoever. So why do people sign up for Part A if they have health insurance from work? It's zero premium. So there's that. And if you have a plan from work that, has a deductible that's $3,000 if you go to the hospital, as you saw in the chart, the deductible for Part A and Medicare is $1,676. So it might save you some money if you have to go to the hospital or something. So that's why some people go ahead and get a Part A. But be careful. If you're currently contributing to an HSA, a health savings account, then you have to stop contributing to that health savings account 6 months before you turn 65, before you start your Part A, that is. Before you start your Part A, 6 months before, you have to stop contributing. It's a IRS tax issue. It's Social Security doesn't care, Medicare doesn't care. It's just between you and the IRS. But if you don't have it, you can go ahead and sign up for Part A and then sign up for Part B later. Um, what about, and I'm sure a lot of people have all kinds of different variables on their questions. If I live overseas, do I still have to sign up for Part B? Well, unless you have health insurance from a particular country that has credible coverage from that national system, then you don't have to, but you definitely need to check with the embassy and consulate on that particular country. But if you've got any other questions, make sure you type it in a chat and we'll go through a bunch of them. What about disability? If you're on disability, you know that you can receive Medicare after being on disability for 24 months, or you can refuse it if you have health insurance for work and everything. But for the most part, in most states, when you're on disability under 65 years old, you can only get a Medicare Advantage plan. Most states, they don't offer Medicare Supplement plans. So you're that's the only thing you can get. But when you turn 65 on disability, you can switch to a Medicare Supplement plan, and there's no health underwriting, no extra cost or anything like that. So you have that special window when you turn 65, a few months before, a few months after. So definitely reach out to, again, whoever helped you with your Medicare insurance, relative, cousin, whoever, or you can reach out to Chapter and they can help you find a plan in your particular area. All right, let's jump into a whole bunch of questions. Looks like we already got a whole bunch of questions, and we've got a few members that joined. Zelda became a silver member. Thank you very much, Zelda. We appreciate the support. And Fuji Mariko-san, yoroshiku onegai shimasu. She became a member as well. Yeah, okay. All right. Beautiful. Thank you very much. Arigatou gozaimasu. Okay. All right. Let's jump into, I was stationed in the Marine Corps in Okinawa for a few years. So there's that. What is the recommended time to apply for Social Security benefits if I am eligible for December 2025 for retirement age? Yeah, a couple 3 months before. Can't do it any more than 3 months before. But about 3 months before is plenty of time. But the most important thing is if you're coming up um, and you want to file for benefits, make sure you set up an account, SSA.gov account, go into the mysocialsecurity.gov, set up that account, to play around with the numbers, see how much your benefits are going to be and all that stuff. But most importantly, check your earnings record, how much you paid into Social Security all those decades, because that is going to determine how much your benefit amount is. So if something is wrong there, then you definitely need to look to get it fixed. So is Social Security suspending accounts for retirees living abroad? Yeah, I saw a YouTube channel talking about that. There's some person, and I guess in the Philippines, didn't get their check or something. I haven't heard anything about that yet. I'm not sure if Elon Musk or one of his teenagers went in there and pushed the wrong button and decided if you're living overseas, you don't. I have no idea. I don't want to start that internet myth. There's so many out there, but I have no idea. But if you're living overseas and Social Security knows you're living overseas, they send you that proof of life form every year, and basically that you have to return it. And now you can actually attest to it over the phone. So they used to send it through snail mail, and you'd have to return it. If you didn't return it, your benefits stopped. So maybe that person just didn't return it, or whatever the case may be. So. Um, I have seen your question for days now. She has to file for benefits first, and no, it won't affect her benefit. Okay, somebody answering somebody else's question there. Let's boost the algorithm. Yes, hit the love. Yes, please, appreciate it. All right. Jumping around here. I'm concerned for my daughters and grandkids and then being on Medicaid. They live in a state that will follow the federal cuts when they happen. Yes, that is the budget proposal that just came out yesterday in order to pay for tax cuts that predominantly go to the very, very wealthy. They're going to make essentially poor people suffer more. Is there fraud, waste, and abuse in Medicaid? Of course, there's fraud, waste, and abuse in Medicare and Social Security and Medicaid and credit reporting agencies and car companies and Facebook, every place, every company what's the source of fraud, waste, and abuse? Look in the mirror. It's us. It's the human beings, right? Anytime we get involved with anything, we work the system. So yes, um, but to throw the baby out with the bathwater, there are millions and millions and millions of people that depend on Medicaid for health care. And to kind of say, hey, we found this one case, Elon Musk did this whole, I found a person who was 150 years old that still on Social Security. Well, that person's not getting paid, number one. They might have, anyway, I talked about that a billion times. But to say, well, okay, well, I think we ought to get rid of the entire system because I found one person that, didn't save Social Security any money. I still haven't seen him come up and say, and this 150-year-old was receiving a check last month. You notice he didn't say that because it doesn't happen. So I'm sure sometimes people get paid longer, like that person that passed away overseas. If you pass away in the United States, then the coroner's office and the funeral homes have a system. They report it to the states, and the states report it to the Social Security Administration. Department of Treasury goes in there and grabs the last check and everything. So, but if you pass away overseas, then obviously don't have the arrangement for all the other hundreds of countries throughout the world. So sometimes those checks, but there's an overpayment on that record, and Social Security usually gets that money back eventually. Doc, I heard some people won't be getting their March check. Is this true? I haven't heard anything like that, and hope no, that's yeah, sounds like it's a all right, good news. Talked to Jake from Chapter, and he helped me under 65. Perfect, awesome. Also, my area has those cards. So Moo P is talking about those grocery cards that you see advertised all over the place, all over Facebook and social media. They do actually exist, but the way they're advertised is really, really scammy. So in your area, you'd have one. But the bad news, have to wait till October. Yeah, yeah. Also, he is going to contact the agent about the 65 thing. Okay, perfect. Sound like Jake is going above and beyond there. Awesome. Um, and yeah, there's enrollment periods and special enrollment periods. Now we're in the open enrollment period, January, February, and March. So for some reason, he was able to get you in there, but sometimes you have to wait until October, the annual enrollment period. But if you move, you can switch your plans. Now is the open enrollment period. If you have a Medicare Advantage plan, you can switch to another Medicare Advantage plan. If you have a Medicare Advantage plan, you can switch back to original Medicare and get a Medicare Supplement plan. But you will probably, depending on your state, have to go through health underwriting. So you can always, try to check that out. So let's see. My husband will be 65 this June. We have 5 kids under 18. His is permanent disability, but have offset. He got lump sum 2021. Is it better he retire and stay in disability? It's more money to stay under disability because if he retires at 65, his benefit amount is going to be reduced because he's taken early retirement. So yeah, if he's still disabled, disability, unable to work, then just stay on disability. Don't have to do anything. But remember, because he's 65, check to see, if he has a Medicare Advantage, he's happy with it and can't, budget a Medicare supplement plan, then he's good. But check to see people, particularly people with disability, it usually pays in the long run to get a Medicare supplement plan because you don't have to deal with the prior authorizations and the nickel and diming that Medicare Advantage. Even though Medicare Advantage plans have 0 premium per month, they nickel and dime you afterwards. $100 for this, $20 for that, and if you never get sick, then perfect. But if you actually get sick, then yeah, there's that. Chapter is very responsive. Thank you for letting me know. Yes, my son and I looked all over the country for a place that would help you all out and, do the right thing. And I think we definitely found it. They're doing an awesome job. I just turned 66 in December 2025. I'll be 66 in 10 months. When should I apply for my full Social Security? Do I need until wait December? Yeah, in order to get you, if your full is December 2025, yeah, you need to wait and a couple of 3 months before then, go ahead and file. Make sure you check your earnings record and all that kind of good stuff. If you've already signed up for Medicare at 65, to sign up for the money is super, super easy because you've already done the difficult thing by doing a Medicare only claim and you proved your age and your citizenship and all that kind of good stuff. So to turn on the money to is really, really easy because you already done the difficult stuff during the Medicare claim. Doc, I heard some people won't get. Okay, I already answered that one. Roy, if I know I want Medicare Advantage plan when I turn 65, do I have to get Medicare first and then switch, or can I go right to Medicare Advantage plan? You have to have Medicare Part A and Part B first. You cannot get a Medicare Advantage plan or a Medicare Supplement plan until you have Medicare Part A and Part B. So you go ahead and sign up for Part A, Part B, and then you start figuring out which one you want. That way you've got some time to, consider the best options for you. Look for your doctors and all that kind of good stuff and pick the plan. And that way, when CMS, Center for Medicare and Medicaid Services, activate your Part A and Part B, then you got your numbers, and then that's what chapter needs to sign you up for a Medicare Advantage or supplement plan is your Medicare number, and then they can go ahead and sign you up. Um, but Dr. Oz and other people in charge now, other Congress people, they want to do it like you just said, Roy, that kind of Medicare Advantage becomes the default. You don't even have to deal with Social Security, I guess, in one of their permutations of their, future is they are going to put people in Medicare Advantages by default. And then instead of contacting Social Security and sign up for Part A and Part B, I guess you would contact, whatever private company and pick their plan and they sign you up for Part A and Part B So they're trying to make Medicare Advantage to the default. Dr. Oz loves him some Medicare Advantage plans. Um, I'm I prefer Medicare supplements if you can get it, but if you can't, then it just takes more effort and you have to, deal with, maybe some prior authorizations and stuff. So it's definitely better than having nothing else. You definitely don't want to just have Part A and Part B alone. Again, unless you're independently wealthy. And if you are, make sure you click the little thing there and become a member and buy me a beer. Or my sister is a disability retired Texas school teacher that opted to pay Social Security, even though she could just use the Texas teacher retirement system. Yet she was hit with a WEP when she retired. Yeah, no, I don't. Yeah, that's not possible because to be WEP'd, she would have to provide a WEP letter at that time. This is that law. Joe Biden signed that law away. It was supported by Republicans and Democrats and Trump and everything, and wasn't supported by me. But anyway, um, but that law went away. But before that, if you were under that non-covered pension, you would have to provide a WEP letter, and that WEP letter from the whatever agency, it would say when you were first eligible for that non-covered pension, when you were first entitled to that non-covered pension. Those are different dates, and how much the benefit is. And that is the only way they can do that WEP calculation is when they have that letter. So she had to have provide that letter, but it doesn't matter anymore. So if she is WEP'd, truly WEP'd, then they are working on it right now. And unfortunately, politicians didn't give Social Security the resources to recalculate those 3 million records. So yeah, they're struggling. And now I haven't heard, you've probably seen on the news, a lot of probationary employees, all federal employees. My office, when I hired people, they were on probation for 2 years. And if you didn't do it, we just said, bye. Um, but I guess there was mass firings. Anybody in the federal government that was on probation. I haven't heard yet of Social Security employees because they've been under a hiring freeze for about a half a year. So they might have some new employees, but they just lost those new employees. So customer service is going to get so much worse. And that's exactly the plan, to keep you from your benefits by not providing help for you to get your benefits. That's why you have to sit here and watch me drone on for an hour every single day. I apologize for that. But anyway, here I am. Have Social Security payments been spent? Okay. Yeah. I think that I haven't. I see a lot of people asking. So I don't see a lot of people saying they have been suspended. So I think it's just that one person, maybe that person's was suspended. So anyway, let's see. Ping pong. If I apply for Social Security in March, but it takes them 4 months to process, will I get 4 months of payments in my first check? If I work while I'm waiting, will my check be reduced for those months? So you're talking about regular retirement benefits. I guess you're talking about early retirement because you're talking about work. Yeah, they if you filed your claim in October of last year and you're still waiting, and then tomorrow they adjudicate your claim and you were entitled since October, yeah, they'll give you all that money back. But you still have to stay under the annual earnings limit. This year it's the $23,400, and yeah, that's you're still yeah. Happy Valentine's Day, everyone. Like and share. Yes, please. Happy Valentine's Day to everyone out there. Or as I like to call it, the annual meeting of the Procrastinators Club. All us guys meet at Walgreens or CVS or someplace, and we buy the last minute flowers and chocolate and cards and stuff like that. So this is our annual meeting. So don't bother us. We have a mission. I'm 62, and Social Security told me deceased husband did not have enough credits for survivor benefits. Yeah, so that unfortunately if that person didn't pay into Social Security for 10 years, the 40 quarters for whatever reason just didn't work, or worked under the table, or worked for one of those non-covered entities, then unfortunately, yeah. Remember, you can, if you were married to anybody else, you don't have to go with the last one. If you were married to someone in your 20s or 30s for 10 years, then you're could be eligible for benefits on that person's record. Should we retire at 62 or 67? The Social Security is a mess right now. Yes, that is a fact. And it's 100% your decision. You just have to ask yourself all the right questions. Do you need the money now? If you're talking about early retirement, need the money? Yeah, if you need the money, get your money. Are you working? If you're early retirement, then you're limited to how much money you can make. This year, it's the $23,400. Anything over that, Social Security holds back $1 for every $2 you go over. Are there people waiting for benefits, for your benefits to start so they can start their benefits, like spouse benefits or children? How's your health? How's your genes? Is it going to put you in a higher tax bracket and defeat the purpose? Can you take that money, invest it, and better than Social Security can? And this is the one I've added recently, is the politics. It's not about the current president. We have been putting off solving the Social Security problem for decades. And yeah, we have run out of road to kick the can down. So yeah, it doesn't matter who the president was. The solutions don't look like they're coming. So it's unfortunate. Tambra, $10. Thank you. Happy Valentine's Day. Have a beer and enjoy the weekend with your family. I appreciate it. Thank you very much. All right. You guys are awesome. Let's see here. Good day, Ed. Today, my friends who are expats living abroad had their Social Security stopped. They are confused. Oh, you had several friends that had their stop. Huh. Yeah, that is not a local district office federal benefits units, overseas, the federal benefits units and the embassies and consulates. That's not anything that they would do. The only way something like that would happen is because these are direct deposits. Sometime in my office we would get a mass alert that some mail truck that was delivering checks to our area, overturned or something like that and burned up or something. And so we'd have to contact everybody that received a check and say, hey, come on down to the office and we'll give you another check, or we'll send you another check. But this is direct deposit. So that's electronic. And the only way that can happen is if someone went into the Social Security Administration or the Department of Treasury and pushed some wrong buttons. So those 19, 20-year-olds, yeah, distracted playing Pokemon or something. And I'm gonna have to keep an eye on that. I haven't seen anything in the news, but this might be the brand new news. Wow. So this is concerning. Do I have recourse to get my retirement benefits at 65 versus suspended amount in 2023? I wasn't told of submitting the 521 within 12 months of going back to work. So you always have recourse. Yeah, if the 521, the request for reconsideration, so your benefits were suspended because of work, yeah, you can file an appeal but those you're always going to lose that. If you made over the $23,400, then that's, you can appeal it, but you're going to lose it, because the fact is you made over 23,400. If you didn't, if someone else worked under your social security number and it wasn't you, or whatever the case may be, then yeah, that's a whole different situation. So I really depend on my social security for my rent. I'm 70 and I really just wanted to know if I'll get my social security for March. Thank you. I appreciate your site. Yeah, as of right now, it looks like the only strange thing we've seen, multiple reports here, is about people living overseas. And the only I don't think it would be, unless, I'm trying to think how this would happen internally. If your bank account is overseas, then I could see that. I could see the fact that they could go in there and push a button and stop all overseas payments. Yeah, that would be scary. But if your bank is a U.S. bank, then yeah, I don't see how they would necessarily know that you're overseas. Internally on the MBR, the master beneficiary record, you have two addresses. You have your mailing address and you have your residence address. But the Department of Treasury doesn't know those two addresses. They just know, the bank account, the rating, the routing number and the account number, and if you're overseas, the SWIFT code and all that kind of stuff. So I'm just trying to think out loud here how that could be messed up. If those people are getting their money directly sent to their overseas bank account, I could see how that could get messed up. Yeah. Wow. I'll be 66 years old this March and planning on retiring this summer. When should I file for my Social Security Medicare? Well, Medicare at 65 if you didn't have health insurance from work, but other than that, a couple, 3 months before is perfect. A legal immigrant is here on a green card and pays FICA. Is his American citizen child eligible for any government benefits? Yeah, American citizen, 100%. Absolutely. Yep. If the and on the child's own record, SSI or whatever the case may be. But if the legal immigrant is here and pays into FICA and pays the 10 years and is insured and, becomes eligible at 62 or whatever the case may be, then yes, then the child is eligible for benefits on that person's record, auxiliary child. Yep, 100%. I need advice. My husband passed on the first. Oh, so sorry to hear that. I'm 63. He was full retirement age and started Social Security October. If I start survivor benefits, what would I receive? You would receive 75, 76, 77, 8% or so of his full benefit amount. Sounds like he was his full retirement age when he started. So it's 100% based on the date you start. So if you start your benefits at 60, that's 71.5%. So actually, yeah, okay, 60. So I was thinking doing the wrong. So yours is probably more. Yours probably about 85, 86. But anyway, I don't want to do the gorilla math and lead you down the wrong road. Call the 800 number, schedule an appointment for survivor benefits, because you can't do this online, and ask them exactly how much your benefit amount would be if you started this month or next month or whatever the case may be. And then ask them how much that benefit would be next year at the same time, a year later. And then you can make an informed decision. And if you want to start your benefits now, you said, all right, let's do it. If you want to wait till next year, you just say, I'll come back next year. And yeah, the Social Security employee will be very, very happy that you say you'll you'll think about it, or forget about it. That means they can go back to their desk and work the other 5 million cases they have pending. I will automatically receive my WEP increase, but I am eligible from spouse under the new law. Do I have to apply, since that would be under spouse's number? Yes. If you haven't already applied for spouse benefits, yes. Thank you, M. Tyndall. There's a lot of people out there that are going to be missing these benefits, because in those particular situations, you have to file, because Social Security doesn't know there are spouses or ex-spouses out there unless you have filed at one time. You won't be on the record. So it doesn't sound like you filed, because you at that time you said, well, I'm not going to get any money anyway, so why waste my time? But now, guess what? It changes. So if you were part of whatever non-covered pension entity you were part of, make sure if you're on a Facebook, whatever, please reach out to those people and say, hey, if you actually didn't file a claim, you have to do it now. And that puts you in the queue for when Social Security is able to get to it. And then contact your politician and say, hey, you know, you sent 3 million new customers down to Social Security. Why didn't you, make sure they could handle the volume, you know? Because that was my plan to break Social Security and ruin customer service so everybody would hate it. So, what is the procedure so we can give it to their, billionaire buddies on Wall Street? What is the procedure to correct when the Social Security portal email has been changed via an online security breach? Here, okay. Um, yeah, the new system. That's a good question with this brand new system. I had to do it a few months ago or a couple of months ago where you get into the new system. I think I used the ID Me, and you contacted the person and they did like a Zoom thing, and I had to hold my ID up to my forehead. And yeah, it's a brand new system. But yeah, just reach out, go through ID Me, and I'm your portal email. You can go in there and yeah, change your email and stuff like that, but you have to go through the whole thing. So I'm not sure what type of online security breach was. It some credit card company or something that, or was it, you know, Elon Elon's minions? I don't know. If you haven't done so already, yes, please click the like button. And this is how people get the information out there. So please play it forward. If a person is disabled at the age of 62, can they still apply for retirement and disability at the same time? Yes, thank you. Good question. Yes, it's called a RIB-DIB. So a RIB is retirement insurance benefits, and a DIB is disability insurance benefits. It's called RIB-DIB. So why would you do that? Because your disability benefits, if you're approved, those are higher benefits than early retirement. Why would you do that? Because Social Security, because of their understaff and everything, they take 6 to 9 months, if you're lucky, to get you a decision on your disability claim. So some people can't wait 6 or 9 months with no check. So if you're at least 62 years old, then you can go ahead and file for retirement benefits on your own record, start those benefits coming in every month so you can pay your rent or whatever. And while you're waiting for your disability to be approved. But be careful there. Um, it depends on when they determine your disability to begin. If they determine your disability began in the future, 6 months later, um, then you've taken 6 months early retirement, so your disability benefits are reduced by however many months of retirement. But if your disability is determined to be prior, then it's not a big deal. So that's why people would file for you don't get both, you get one or the other, you get the higher one. Let's see, Julie, I'm 55 on disability and my are low because I was a stay-at-home mom, raising kids with my husband for over 30 years. But we've been separated for about 16 years. Can I get any benefits from him? Yes, absolutely. You were married to the person for at least 10 years. Um, but you can't get them now. You'll be able to get them at 62 years old. So you're on disability now. When you reach 62 years old, and this is for everybody on disability, when you're on disability and you reach 60 years old, check to see if you're entitled to any surviving spouse benefits on anybody's record. When you hit 62 years old, check to see if you're entitled to any spouse benefits, living spouse benefits on anybody's record, divorce spouse benefits. When you're 65, check to see if a Medicare supplement plan is best for you. And then once you hit your full retirement age, then that's when you're no longer receiving disability benefits. Your disability benefits switch to regular retirement benefits, and there's no more limitations on work. There's no more CDRs and all that kind of good stuff. You're, as Robin Williams and Mork and Mindy used to say, you're free. But you know how that anyway. Roy, $20. Thank you. Thanks for providing all the information to me and everyone. Have a great weekend. Thank you so much for your support, Roy. You're awesome. Thank you. Joseph, I retired and filed for Social Security old age insurance. At that time, my WEP was $300. What would my adjustment be today? It really depends on how much your benefit amount and everything is. Yeah, it's a strange calculation. And how much your benefit amount from your non-covered pension. But if yours is WEPT, you got that WEP PIA, you're recalculated, you're just waiting for Social Security to get to you. And the reason they're taking so long is because again, politics. So reach out to your politicians. Everybody that's in this case, everybody that has to wait 6 to 9 months for a disability decision, everybody that has to wait for their benefits to be recalculated, everybody that has to wait for 3 hours on the phone to talk to somebody, contact your senators, your two senators, contact your House representative, congressperson, whatever congressional district you're in, contact them, call them. Here, let me throw up the phone number um, to the switchboard. Let me get rid of this thing. So here's the U.S. Capitol switchboard. Call them up and talk to your senators in your House. Call the president and say, "Hey, what are you doing to, save Social Security? What are you doing to improve customer service?" And don't let them give you some BS about telework or something like that. That's just all BS. If you want employees to go back to the office, fine, but that's not going to improve customer service because they were working from home. I don't know if Congress realizes there's this thing called cell phone that you can pick up, from, you don't necessarily have to be at your office, and they're 100% monitored. So, but they're not cell phones. It's voice over IP anyway. But anyway, so yeah, I've talked about why that's BS. So when telework ends in a week or so ago, then customer service will be 100% perfect. It won't. And so that means politicians were lying to us. Go figure. Go figure. But we fell for it. Milkmaid. I own my own property outright. I applied for disability in 2015 and was found 20% disabled. Okay, that's not Social Security. So that might be VA or something. I was also told that if I received disability, government would take my property at my death. Yeah, that's something. That's Social Security does not have 20% or 30% disability or anything like that. It's you're disabled or you're not. So that must be something else I can't help you out with. I'm seeing on social media that Elon is planning on cutting into Social Security. Tells me this is fake news. Well, he's I'm gonna do a thumbnail on this, and here's my idea for a thumbnail the next few days. Elon and Doge, um, uh, shocking news. Water is wet. Because so far the stuff that they found, that supposedly the 6.2 million people that are over 112, that's been a BS story since 2015. Show me how many people are actually receiving money. That's fraud, waste, and abuse. If they say, okay, we're going to close out these 6.2 million records, that is super fraud, waste, and abuse because it's going to cost millions and millions of dollars to close out those records. And they're not going to save anybody any money because those people are not receiving payments, maybe one or two or five or something, if that. So yeah, that's a complete waste of money. Talk about fraud, waste, and abuse. So, and the reason, this has been the plan since the 1980s is to tax Social Security, tell about how competent it is. The trust fund was stolen, telework and, fraud, waste. Yes, there's fraud, waste, abuse again. But all these are attempts to, you know, death by a thousand cuts. So, because if people love Social Security and the customer service was awesome, and then politicians came in there and said, "Hey, we're going to take it away from you and give it to our buddies on Wall Street," people would be outraged. Well, people I think would be outraged anyway. But it's easier if you destroy it first and ruin the reputation first. So that is exactly the plan, and they are really, really successful at it. Except for the people that watch this channel, we've got their number. I've been seeing videos of retirees living overseas with Social Security. Okay, yeah. Videos are just one video. Yeah, this seems to be a common theme today. Again, the only way that can happen um, is out of the Department of Treasury or the headquarters in Baltimore. So either someone got in to the main system in Social Security in Baltimore, or the Department of Treasury and did that. That is the only way that can happen in mass like that. So thank you for letting me know. My Social Security statement indicates the following. You are already receiving or have qualified for benefits. It also indicates suspended in the past, affected by GPO, so no need to call Social Security. Yeah, so that sounds like you already filed a spouse claim at one time, and yeah, and it was full offset 2/3 of your non-covered pension offset what you would receive from your spouse or divorced spouse or surviving spouse, whatever the case may be. So that means you've already taken the claim and you're already on there. But just make sure your address and phone number updated. So on that record. So that's the important thing. That way, if when they get around to you and they want to release that money, they want to make sure they release it to the correct person. So they might reach out to you, send you a letter, and update your direct deposit and all that kind of good stuff. So, my husband called Chapter to ask about dental insurance. Yeah, Chapter really doesn't. Yeah, there's a lot of people that make a lot of money on dental insurance out there, but Chapter, that this is what I like about them. They're like, contact your doctor, your dentist. Chapter could make a lot of money if they sold dinner and dental insurance, but they decided not to, and I kind of agree. I agree with them. There's certain circumstances you might, but well, you might anyway. Chapter realizes you might, but the best way to do it, because people have dentists they like to go to, so just contact your dentist and say, "Hey, I like you. You're a good guy or good gal. I want to continue using you. It looks like I might have some, more stuff in the future and stuff. What do you take? What kind of dental insurance you take?" And that your dentist will tell you and give you the phone number, and you just, sign up with them. Or sometimes the dentist says, "Yeah, you don't need any. Your teeth aren't that bad and stuff. So, I'll give you a cash discount." So yeah, so I really like Chapter for doing that. They could make a lot of money if they, did dental insurance, but they decided not to. So that's awesome. Veteran here, use the VA only. Does it count as credible coverage? No, it does not. Good question, Kit. Thank you. No, it does not cover it. It does not count as credible coverage. VA, if you're on TRICARE for life, you're actually retired, then you still have to get Part A, Part B anyway. But if you have VA medical, and I know where you're going here, you're trying to get out of paying for that $185. But there are Medicare Advantage Part B give back plans out there that pay for part of your Part B, $100, $50, $185. So there might be one available in your area. That way you can keep your VA, get your Part B, so you're not penalized in the future in case you decide to sign up for Part B or change your mind or whatever. So yeah, you could reach out to Chapter there and say, "Hey, are there any Medicare Advantage Part B give back in my area?" And they'll look for one, and yeah, so you can have your kind of cake and eat it too. So, and most of those are directed. They're called Patriot plans and Honor plans because that's who they're usually directed to. So, Mary, what's up, Mary? And my son disabled at 53, draw his wife's Social Security. She works and is 43. Okay. Yeah, that might be a disability type of situation. I don't see a drawing. If well, the only time a disabled person can get. Oh, okay, the son is disabled at 53, and okay, I get the relationship here. So his mother is receiving Social Security, disability, retirement. Sounds like disability here, and because she is receiving disability benefits and she has a son that was disabled before the age of 22, this is called disabled adult child benefits, then yes, perfect. So it sounds like Social Security treated you right, and so your son will continue to get those benefits on her record. He is receiving 50% of her full benefit amount now, up to 50%. If there's only one, then he's receiving 50%. If anything should happen to her, then he will be a surviving disabled adult child, and he'll get 75% of his her benefit amount. So let's see. Of course, Social Security doesn't care if I'm 65 if I want Social Security, but they do want to force me onto Medicare at $408 a month out of pocket. But my full retirement age is 67. This is a racket that needs to end. Yeah, that Social Security doesn't. That's a Medicare type thing. So you're $408 a month. So that means you have that IRMA extra premium because you made over 106,000 or $212,000 a couple of years ago. So you're paying that extra Part B premium. So yeah, I mean, car insurance is a racket. I'm not gonna. I haven't had it. I haven't had an accident, since I was 17 years old. And why do I have to pay car insurance every day? It's because people, yeah, do have car accidents, and That's the pooled risk of insurance, and the same thing with Medicare. It's a pooled risk. Um, so if everybody signed up for Medicare or car insurance the day they got sick or an accident, then yeah, those companies wouldn't be around for more than 2 minutes. Jack, $5. Thank you very much. And Jack has a question. I turned 62 January 2026. If I file 3 months before my birthday, will my 25 income be considered? If I file Social Security before I file, okay, before I file taxes, I wouldn't even worry about it. So you turn 62 January 26, so you're not eligible for benefits until February because you have to be 62 the entire month. So you're eligible for benefits February, you'll get your first check in March. But yeah, your 2025 income won't be in there, but it's no big deal. You just go ahead and file, you get your benefits, and then 2 months, 3 months, 4 months, 5 months down the road, when Social Security gets your 2025 earnings, reported by the IRS, your W-2 or whatever, then they will do the recalculation. And if it turns out it's one of your high 35 years, and it will increase your benefit amount, they will automatically increase your benefit amount and make it retroactive all the way to January. So you're not going to lose anything. So just go ahead and file when you want to file, and all the rest of it will take care of it. Let's see. My first ex is deceased, and I applied for Social Security but received a letter from Social Security stating because I'm on disability, I can't get his. I am now 61 and asking, should I try again? Would that payment go back? Okay, so your first husband, you were married to him, it's a divorce type situation, 10 years. You applied. Well, it's not because you're on disability, maybe because your disability benefits are higher. You can get disability benefits and spouse benefits, divorce spouse benefits, surviving spouse benefits, but the calculations have to be correct. So for surviving spouse benefits, his benefit amount has to be more than yours. And then because you're getting it at what, 61, you'll get, X amount, 75, 76% or so of his. So it sounds as though there's just no more money there. You're not entitled. You're entitled to those benefits. There's not more money there. I would ask them, it says, okay, my benefit amount is 1,000, and if I get benefits from his, it would be 950, and therefore mine is more. So I understand that. But ask them, okay, what about, in 2 or 3 years, because when you file for surviving spouse benefits, most of the time, those benefits are reduced when you take those benefits early. So maybe a year or 2 years from now, those benefits might be more. So you might be eligible at that time. So I would give them a call back, and then they'll say, oh yeah, no, your benefits are always higher. So you're never, and that way, just to forget about it. But if they say, yeah, in 2, 3, 4, 5 years, his benefits are going to be higher, so you can switch at that time. So, Hector's great job, Dr. Ed, sharing your channel since most of my siblings and in-laws are approaching 65. I appreciate it. Thank you very much. You guys are awesome. Got a new Social Security letter saying I have 37 credits out of the 40 needed. How long will I have to work to get the other 3 credits? Oh, where's my little cheat sheet for this year for the, I don't know, I think my cheat sheet or my other room. What is like 14, 15, $1,600 or so this year for a quarter of coverage? So let's say you're 37. So let's say 75, let's make it easier, $6,000. So you need 3 quarters of coverage. And let's say each quarter of coverage is a couple thousand, it's under 2,000. But anyway, let's say a quarter of coverage, $2,000. So you need to make $6,000. And you can make that in one day. So here's how it works. It changed many decades ago. If you make $6,000 January 6th, now you have 40 quarters. But you can't, even though you've accumulated, you can't use it until that quarter starts. So your first quarter started January, you're insured, so you're good. March 1st, and then we're talking what, July, and next is October. So yeah, so if you're getting 3, you need to wait, the 9 months, or actually 6 months, for the start of the third quarter, and then you can get your benefits. So probably in July, reach out to Social Security And because Social Security won't have your pay stubs at that time because it's not the end of the year, um, you just provide your W-2 or a pay stub that shows that you worked at least, those 3 quarters, and, they can start your benefits. They'll just manually put that stuff in there and get you started. 2025 COLA for federal employees and retirees was 3.5%. As usual, Social Security was less than 2.5%. Is it because Congress knew WEP would be eliminate Social Security for them? Now that Fairness Act passed, want to bet they changed that? No, yeah, it didn't have anything to do with the Fairness Act. Politicians don't control COLA. They control the way it has been calculated for since the 1970s, essentially, but they don't control it. It just the Bureau of Labor Statistics looks at the inflation rate from the third quarter of one year, compares it to the third quarter of the next year. So yeah, Congress, yeah. The only reason it was a little bit more is because I guess they said uh, that it was an increased COLA, because I think they said the federal employees haven't had a anyway. So, but yeah, no, the COLA itself is different, not, and then they made it non-political. Will the Social Security notify about changes to the WEP? No. Well, it, it was in the news for 40 years. And yeah, it's been really in the news. In terms of your particular change, if you are wept, they will notify. Yeah, well, they will send you a letter when they do the calculations. So you make sure your address, point of contact is updated. Make sure your direct deposit and all that kind of good stuff. Your phone number, and that way, if they need to reach out to you, they'll help you out. Ed, thanks for your help. I do have a question. You commented on Social Security limitation for military veterans in your video 2 weeks ago. What is that? The limitation. Social Security limitation. Well, the only thing in terms of retirement benefits, Congress said that Social Security should give a little bit extra earnings in particular years if you served in the active service. So when you file for benefits, that's why the Social Security asks you, when you served active duty in the military, and they might ask you for the DD 214. I think nowadays they automatically connect to NARA.gov, the National Archives and stuff, but it increases your benefit. It's just not very much, but hey, a buck's a buck's a buck, right? Thank you, Ed, very much. Appreciate you. Hey, thank you. I appreciate it. How long do they give you to fill out the proof of life form? Because I've seen reports that Social Security is telling expats they were sent the form a year ago, but Social Security was just cut off this month. Yeah, they send it out in July, and then if you don't respond, they send it out in October again. But again, they just changed it to where you can do it over the phone, and what's Social Security attestation, where you call them up and say, "Yeah, I'm alive. I'm living overseas," and they ask you a whole bunch of information, to confirm it's you, and that way your benefits continue. So let's see. I'm jumping around here. Let me see if there's people I don't recognize. Oh, there's let's see. I don't think I see Maria before. Dr. Ed, am I stuck with a suspended amount for early retirement benefits because I did? Oh, okay. I already answered that one. Let's see here. And there's Roy there. I appreciate it. Does getting a refund of over $2,000 from the IRS or your state or your taxes affect the maximum you can make of the 2,000 on the dual program? On the dual program, so you're talking about Medicare Advantage dual eligible plan, possibly that dual program. Um, the Medicare Advantage dual eligible plan is available to those people on Medicaid and Medicare. And obviously Medicare doesn't matter if you win $1 million or $1 billion. They'll charge extra premium, obviously, probably. But you can still keep Medicare. Medicaid, that's a whole different thing. So if for some reason your particular state wants to kick you off because now you got $2,000 payback or whatever, but yeah, I would reach out to your Medicaid in your particular state. And usually you can do what's called a spin down. And you can say, yeah, I got 2,000. Actually, it was due me because they did, a refund last year or something. I paid too much. So it's not really income. It's a refund because you paid more last year. So just, might be a good idea to reach out to them and then say, and I spent it the first day because I needed a new air conditioner, a new heater, I needed to fix my car, or whatever the case may be. So usually a spin down takes care of that. All right, we are over an hour. Let me get one more here. Wife is using our email for the guardian account that she has for our disabled daughter. Tried to apply for Social Security, but it says she already has an account on ID Me. Different email needed. Oh, okay. Yeah, the new system is kind of wonky, and sometimes you have to do little workarounds, um, and go in there, and they send you the code, and then you have to do a little Zoom thing, and so, and they're, yeah, it looks like, they're doing a little bit different every single day until they finally, get it set up. But it's good. This is all very, very good. It's annoying as heck, but all of that security nightmare inconvenience is in there for a purpose to protect your Social Security information because, knock on wood, you don't hear about Social Security losing Social Security cards and stuff like that. You hear about, Medicare insurance companies and this department store and stuff like that. But Social Security database itself, you don't really hear about that because Social Security is really militant about protecting your Social Security number and all that. And anytime you say, "Oh, Social Security numbers were released," it wasn't by Social Security. It was by some private company that had those Social Security numbers. So again, knock on wood, I've fired a few people in my office that were going in there and accessing Social Security records that they shouldn't have. Red flags pop up, and I go over there and, "What the heck were you doing?" Oh, and so bye. You're done. Big chicken dinner, as we used to say in the Marine Corps. Bad conduct discharge. All right. That is it for today. I'll be back again tomorrow. I'll pick another topic for tomorrow, and I'll answer as many questions as I possibly can. You take care of each other, and thank you for all your support, and have an